Hello everyone, this is Dr. Sheena Bansal. Today we will discuss what is delayed walking, when we should say delayed walking, and what are the different abnormal walking patterns. Firstly, if your child is not walking till 18 months of age, then it is called delayed walking. Many parents get panic when their child doesn't start walking at 12 months of age, but it's absolutely normal. Uh, if he doesn't walk till 18 months, then we will say it is delayed walking. The causes of delayed walking can be many. It may be due to cerebral palsy, it may be due to spinal dysraphism, it may be due to muscular dystrophies, it may be due to hypothyroidism. Because in these cases, in hypothyroidism, like we get proximal myopathy. So he may start delayed walking. Now, what are the abnormal walking patterns? There may be a child may start walking with a limp. There may be many causes. The causes will depend on the age of the child. Like if he is of uh, 0 to 3 years old, then it may be due to developmental dysplasia of hip. In the developmental dysplasia of hip, and the limb will be painless. It may be due to coxa vera, the same limb will be painless. In the case of septic arthritis or osteomyelitis, the limb will be painful. So, in the if he is of 0 to 3 years old, then we will suspect it might be due to developmental dysplasia of it. It might be due to coxa vera. It might be due to juvenile idiopathic rheumatoid arthritis. It might be due to leukemia. In the juvenile rheumatoid arthritis, it will be painful. In leukemia, it will be painful. Septic arthritis will be painful. So in those children, the child may have limping. In the cases of if he is of 3 to 10 years old, then we will suspect it may be due to Perthes disease. In the earlier stages of Perthes disease, due to synovitis, he may have painful limb. Otherwise, he will be having painless limb. It may be due to coxa vera, and it may be due to neoplasms. It may be due to septic arthritis, osteomyelitis, TB hip. And if the child is of 10 to 14 years old, like in the puberty years, then we will suspect idiopathic chondrolysis of hip. The first in the idiopathic chondrolysis of hip, we will suspect, and in these years, we will also suspect SCFE, that is slip capital femoral arthritis. Sorry, SCFE, that is femoral epiphysis get displaced. Actually, it is a misnomer. We know metaphysis get displaced. Other reasons may be in the 10 to 14 years old will be the same: septic arthritis, osteomyelitis. These diseases can occur at any year, and will be having, due to inflammation, will be having painful limb. So we will differentiate the walking pattern on the basis of age and on the basis of the if whether he is having painful or painless limb. It might be some parents may be complaining their child is walking with in toe feet. In the in toe feet may be due to the it may be due to anteversion, femoral anteversion. That is absolutely, we will reassure the parents, because in 99% cases, it will resolve on its own. And there may be out feet gait. If a child has just started walking, then he may have wide base gait, and it may be it may look like it may look abnormal to the parents, wide base gait, but if a child has started walking, then in the starting years he may have wide base gait. That is absolutely normal. We call it as toddler's gait. It will correct on its own. And in the cases of hyperlaxity, also child will have wide base gait. That will also resolve on its own cause of parents, cause of mother's hormone that is relaxing. The child will be having hyperlaxity, and these symptoms will take some time to resolve, and then ultimately they will be resolved. In the cases of dorsal coalitions, also the child may have limp. Dorsal coalition also we see mainly in the 8 to 12 or 12 to 16 years, depending on its type. And in the tarsal coalitions, it will be painful, and there will be a reduced subtalar motion. And in these children, we will suggest according to the stage and according to the type, the treatment may be advised. So that was all about abnormal walking patterns and delayed walking in children. We cannot, in the cases of CP, if child is not walking even at yeah, 12 months of age, then we can consider it, uh, consider taking any management, cause in the CP, the child will have some symptoms in its earlier period, like he may drag while crawling with one leg. That is the main sign seen in the hemiplegic CP. He may have early handedness. Normally, we saw handedness after 2 years. If a child has early handedness, it may give us clue to the cerebral palsy. Otherwise, it is very normal to start walking till 18 months of age. If a child is not walking after 18 months of age, then we will call it delayed walking, and we will start investigating. But in cases of CP, in the earlier neonatal period or in the first year of life, the child may have many symptoms or delayed milestones, which will tend us to investigate early. Okay, with this,